bone and joint health has become a growing concern.
Even in children, rickets, osteomalacia is a common problem. Knock knees in kids also.
Is it related to lifestyle or maybe posture or sitting for a long time?
Majority of us are with a slouched back, with a drooping neck on our phones.
What are the early signs of weak bones or joint damage?
Pain radiating from your lower back down to the legs, numbness and tingling, stiffness, evening fatigability, all those things are alarming.
Blood thinners, how safe are they? Hello and welcome to India TV. I am Shivangi and you are watching HealthDNA. In India, whether it be young professionals or senior citizens, bone and joint health has become a growing concern. Many people struggle with pain and discomfort and they are often unsure when to seek medical help or how to prevent further damage. To help answer these questions and provide guidance, we are now in conversation with Dr. Sumit Bhushan Sharma, who is an orthopedic from Max Super Speciality Hospital. So, welcome to India TV.
Yeah, good afternoon everyone. I'm Dr. Sumit Sharma. I'm heading the Department of Joint Replacements in Max Super Speciality Hospital, Sector 128, Noida.
Sir, as I said, joint problems, bone problems, these are now growing in India. And if I ask you, what are the most common problems that you see in patients today?
In Indian patients and the Asian counterparts, predominantly knee osteoarthritis followed by low back ache. Whereas in Caucasians, especially in US, where I worked for close to 6-7 years, it was more of hip osteoarthritis which we used to encounter.
Okay. And at what age do these problems usually begin?
As far as osteoarthritis, which is a degenerative joint problem, they usually commence at around 50, 55. And if it's a sport related injury, then probably you get to see it much younger, maybe 20, 25. And in rheumatoid, which is another form of arthritis, this typically becomes prevalent in young females. Symmetrical joint pains may start at around 25, 30.
Okay. So, sir, many people have this concern. They feel that, these bone and joint problems are common related to aging. They feel that, it happens only when you get old. So, is it true or not?
Well, there is a paradigm shift in my practice now. We see all across the age groups, even in children, rickets, osteomalacia is a common problem. You see bow legs, you see knock knees in kids also, which are deficient in vitamin D and calcium. So, it's not related to one part of the spectrum. It's both sides of the goalpost.
Now, as you said, children, even in young professionals, these problems are increasing. What do you think are the major reasons behind that? Like, why are knee and back pain is growing among young professionals these days? Is it related to lifestyle or maybe posture or sitting for a long time, maybe even binge watching on our phone? Is it also related to that?
See, majority of our professionals are indoor bound.
Yeah.
None of us are into outdoor sports, majority of us, especially the way we are sitting. We have to first encounter the way we are sitting. Majority of us are with a slouched back, with a drooping neck on our phones. So, once you're sitting, at least make sure you're upright. If you're watching on a computer or working on a screen, make sure it's at an arm's length. Lower back and other exercises do help, especially for knees, walking and cycling and swimming. All these exercises do help to retain your normal musculature and increase the bone strength.
Right, sir. Now, there is a question in the mind of many people, and that is that when should someone take body pain seriously instead of ignoring it?
If you have morning stiffness, which is prevalent more than 10 to 15 minutes, if you have multiple joint pains, if you have lethargy, weakness, if your joints are getting deformed, then yes, you should definitely see an orthopod in your vicinity.
And what are the early signs of weak bones or joint damage?
Severe pain, pain radiating from your lower back down to the legs, numbness and tingling, stiffness, evening fatigability, all those things are alarming. Even a simple low back ache, which you might think a spasm, may be alarming for someone.
So, sir, again, I would like to ask you, does long hours of sitting and mobile use harm bones and joints?
Yes, posture plays an important role. As I said, sitting is not a great posture for your back. Standing is good, lying down is good. Even if we are operating for a long time with a drooped neck, we definitely have, even as doctors, we do have cervical issues and lower back issues. So
Right,
yes,
sir.
posture plays an important role.
Posture plays an important role. Now, there's also this question in people's mind about the difference between arthritis, osteoporosis, and normal joint pain. Could you please help our viewers understand the difference between these three?
See, osteoporosis usually starts at the age of 40, 45. It's more prevalent in females post-menopausal. That is because of weak bones. And how do you objectify it? You objectify it with the normal T-score test. If it's less than 2.5, it's osteoporosis. If it's more than 2.5, especially in that yellow zone, then it's osteopenia. Porosis means deficient, bones are deficient in calcium. Layman term, penia means it's little less but not exactly deficient. And that usually occurs in old age, beyond the age of 45, 50. It usually commences, especially in perimenopausal women.
Right. And so, what is arthritis?
Arthritis is usually when joints, arthritis is a joint problem, joint pain. And how does it start and how does it manifest? Usually, if you look at your x-rays, there is a joint, there is a gap between the two joints. If they start rubbing each other, then this is known as arthritis.
Like
and
you have this also, you can explain
this is
as well.
probably a knee replacement
Okay.
model, but yes, in layman terms, for example, this is a knee model. If we look at your knees, this is your thigh bone and shin bone. If we get a standing x-ray, normally there is a space between the joint. And if they start rubbing each other, that is where the arthritis starts.
Okay. And how can one differentiate between all these three? Like arthritis or osteoporosis, the pain they are having through that? Or is it a joint pain, normal joint
Usually
pain?
a simple muscle spasm or a joint pain can be relieved with rest, ice packs and painkillers. But a arthritis pain won't be recovering with simple painkillers. It's just not you pop in a pill and it recovers. Osteoporosis pain and joint arthritis pain do not recover with those medications.
Okay. Now, sir, as we talk about today's generation, we are very much into gymming and, workouts. But I want to ask you if regular workouts are running, if it could damage our joints if it is not done incorrectly. Is it true or not?
Obviously, you don't work on your lower backs, you don't work on your core muscles, and you one fine day you start lifting weights, you're bound to have a low backache. Similarly, it should be obviously under a trainer, and walking is great for your knees, cycling is great, swimming is great. When we do all those jumping, squats, sitting cross leg, all those contact or impact sports, then your knee takes a toll.
Right. And how does body weight affect knee and hip health?
Well, it's not alone the body weight, it's a BMI, height and weight ratio. In majority of the Indians and normal population, it's 20-25. Beyond 25 or 30, beyond 30, it's obesity. Once you are in that zone, then hips and knees start degenerating. As a rule, if you are, say, 60 to 70 kg, almost 5 times the body weight you put on your knees and your hips. That is how it takes a toll of your body weight.
Okay, so body weight also takes a toll on our joints and bones. But sir, how could someone understand and find out if he or she requires knee replacement, and how can someone know that, now is not the right time?
For me, in my clinical practice, indications are clear cut. Age preferably more than 50. X-rays, as I said, should be rubbing each other, and patient should not be able to walk for 2.5 kilometers at a stretch, or it's a painful limp. These are the indications when probably medications are not the role.
Okay.
Painful walk, age more than 50, X-rays showing arthritis.
So these are the symptoms.
Yes.
And is knee replacement safe in elderly population?
Well, in majority of it's a pretty safe surgery, provided we follow all the rules and pre-anesthesia checkups. Especially in US, it was, as a rule, it was only one knee replacement at a time. Here in India, because of multifactorial reasons, we go ahead with both knees. Yeah. So it's safe.
And is it safe being done at the same time or not?
My preference beyond the age of 65 is always one knee at a time.
Okay.
And beyond the age of 70, definitely one knee. That is safe for the patient, just 1.5 hour surgery, and you are out of the OT and anesthesia within an hour or so. We can't subject a patient with in a prolonged surgery with a cardiac risk. So it's safe beyond the age of 65 and 70. Try getting one knee rather than getting ahead with both knees.
Okay. And how long does a knee replacement last?
If done well, if taken care well, it should last, it should usually outlast the life, but usual lifespan is 15 to 20 years.
And what are the risks that are involved after a knee replacement?
Usually none, provided patient has no infection pre-op. Number one, sugar is under control, what we call a 3-month sugar. HbA1c should be less than 7, BP and stress echo, because surgery is ultimately a stress to the body. What we do here is a dopamine stress echo, where we subject the patient and simulate the surgical conditions. If those tests are negative, usually nothing usually happens.
Okay. And moving on to hip replacement, when is hip replacement advised over medicines or physiotherapy?
See, hip replacement, hip patients are not that common in India as compared to knee.
Yeah.
But post-COVID, post-steroid intake, we have started seeing a lot many hip replacements. And cause of hip arthritis is steroids, alcohol, or any injury. And these are the conditions which can lead to hip replacements.
Okay. And can patients walk, climb stairs, and return to daily life after surgery? Or how
Definitely
long
yes.
it takes for that?
Definitely yes. Usually the surgery, if I just walk you through for, if time permits, surgery is about 1.5 hours, 7 or 8 hours in high dependency unit. The next day post surgery, we make you walk with a walker, and usually all the drain pipes and everything come out in 3 days. Walker remains for a period of 10 days and a stick remains for a period of another 2 weeks. So probably after 3 weeks, we are looking for a unassisted walk.
Okay. And if you compare both hip replacement and knee replacement, is recovery from hip replacement, is it hard or better as compared to that knee replacement?
Pretty much the same, because hip replacement usually occurs in younger population who suffer from avascular necrosis or hip arthritis, but pretty much the same.
Right, sir. Now, as you said, like if you talk about replacing both knees,
Yeah.
you gave the idea that after 60 or 70, it is not recommended.
Yeah, it's usually a guidelines, American Association of Orthopaedic Guidelines, which
Yeah.
we follow.
Also, sir, but moving on, if you talk about surgery, what about robotic surgery? How, I would say, I would like to ask you how beneficial it is and how beneficial it is as compared to the manual surgery that is done.
See, robotic is a path.
Yeah.
It's not a destination.
Okay.
It's a tool which we have to use. A knee replacement, basically a knee replacement is not, we don't replace your knees. Majority of the patients do ask us whether we replace the knees or not. No. This is a knee socket, right? We cut 5 mm of bone from here and 5 mm of bone from here. How accurately we cut it? Definitely robot helps us out. And then we put a cobalt chromium tray here and a plastic and a cobalt chromium tray here. So this becomes your socket. Right.
Okay.
So worldwide, the registry is pretty much the same, whether we do it manually, provided we are doing it well, or whether we use robotics. So all are the same, they lead to the same path.
Also, sir, people have this question about blood thinners. Why are they given after joint replacement and how safe are they?
Usually the blood thinners are given 3 to 4 weeks post surgery, hip and knee replacements, and they're pretty safe, and they decrease the blood clot formation in the legs. And Indians are usually at low predisposition of these things, but Caucasians were at high disposition of blood clots, where blood clots can migrate to your lungs, can migrate to your heart. So blood clots, these blood thinners need to be taken for a period of 3 weeks post surgery. It's
3 weeks.
mandatory, absolutely.
3 weeks, it is mandatory.
Yeah.
But also, sir, what factors decide that how long an implant will last?
See, as I shown you in my previous videos, post knee replacements, patient can sit cross-leg, can squat, but that is not the way a knee replacement is designed. A knee replacement is designed whereby you can bend your knee up to 120 degrees, not beyond that. Obviously, you can sit cross-leg, but that is where the plastic starts wearing. So if you want to have a good longevity of the implant, avoid squatting, avoid sitting cross-leg, but walk. The more you walk, the better the implant will be. This surgery is designed for you to walk for 2 to 3 kilometers daily.
Okay, 2 to 3 kilometers
Oh,
daily.
yes.
Wow,
Yes.
that's nice. But people also have this question in their mind that can joint replacement fail, or does it need revision surgery later on? Is it
Yes,
also the case?
you need to first find out the cause, especially as I said, preoperatively you have to rule out infections. You should, like you take care of artificial teeth, you don't eat sweets after that. So similarly for this implant, squatting, sitting cross-leg is not a big no-no, but definitely should be the last priority. If you have fractures around the knee, if you fall, if you have infection, those are the causes of failure. But yes, advantages definitely outweigh the disadvantages of this procedure.
Okay. So, sir, what would you tell our viewers about the habits that can help protect joints and implants for a longer term?
As I said, pre surgery, post surgery, the basics will not change. Number one, walking is great, cycling is great, swimming is great for your knees. Anything beyond 90, whether with the artificial joint or whether with the normal joint, is not really recommended for your knee.
Okay.
So, sitting cross leg for a long time, squatting for a long time, using stairs continuously for a long time, or running on a hard surface or a treadmill for a long time is not really beneficial for your knee that way.
Okay. Now, sir, we have a segment in our Health DNA wherein we try to bust myths. Now, people have many myths and misconceptions in their mind, so we need to bust them so that they are aware of the true information. So, I'll just say a statement and you have to tell us if that is
Yep.
true or false. So, the first statement is that joint replacement is only for people above 70. Is this fact true or false?
No, majority of us, the Indian patients are getting it at the age of 55 to 60. It's indication, not the age that
Okay.
matters.
It's the symptoms and the
Yes.
indication that matters.
Because ultimately, joint replacement is not a cosmetic surgery. It's designed for you to walk. If you cannot walk, then you will suffer from other ailments like cardiac ailments. You might go down the angiography, blood
Yeah.
thinners, all those things. So, it is walking that decides. If you're not able to walk for 1.5 kilometers at a stretch, then yes, we should be contemplating a surgical methodology.
Right, sir. Now, moving on to the other statement. Some replacement lasts only a few years.
Usually, it outlasts your life. 15 to 20 years is the usual longevity of these implants.
Okay. Uh, After surgery, patients can't walk normally.
No, they can easily get back to their pre-disease level. They usually walk
It
normally.
takes time, roughly 2 to 3 weeks, as you said.
Maximum 6 weeks is your recoup time. 6 to 8 weeks, you don't require a walker or a walking aid.
Okay. And people also feel that joint replacement causes lifelong pain.
No, it won't replicate your normal joint. You will have that crackling feeling like with an artificial tooth. But yes, the goal of the surgery is obtained. You definitely walk for 2 to 3 kilometers at a stretch. You have a painless life thereafter.
Okay. And as you were discussing about blood thinners, many people have this misconception that they are dangerous and that is why they do not take them. But is it true or not?
It's not dangerous. Even after putting a stent in the heart, you need to have blood thinners lifelong. So, after a joint replacement, blood thinners are usually recommended for a period of 3 weeks after your blood tests.
Okay. Well, I guess you helped us bust all of our myths. And what I could learn from this interview is that healthy bones and joints are key to staying, healthy and active throughout your life. And taking care of your bones and joints early can make a huge difference in your quality of life. So thank you, sir, for helping us understand all the nitty-gritties of this section, because many people are not aware that how bad posture might affect them. Watching continuous reels by not having a look on your posture is going to affect you all. So about our viewers, if you like this conversation, then do comment and let us know. And for more such interviews, stay tuned with India TV.